Welcome back to the Deep Dive. This time we're diving into Robert F. Kennedy Jr.'s book, The Real Anthony Fauci.
Okay.
And wow, you guys sent us a lot of excerpts.
Yeah.
It seems like everyone's ready to explore some really big questions, right?
Yeah.
About public health and science and maybe even democracy itself.
Absolutely.
Okay.
Kennedy's book, it's really a deep dive into Dr. Fauci's 50-year career, especially his time at NIA.
Right, the National Institute of Allergy and Infectious Diseases.
Yeah, exactly. And he really focuses on Fauci's response to AIDS and COVID-19. And, he questions the influence of pharmaceutical companies.
Oh, yeah, big pharma.
Big pharma, figures like Bill Gates, and even government agencies on public health.
Okay, so right off the bat, I want to be super clear.
Yeah.
We are not here to tell you what to think. We're just going to break down the key points that Kennedy raises and help you understand, the controversies.
Yeah.
And encourage you to think for yourself.
To form your own conclusions.
Yeah, exactly. So where do we even start with a book this dense?
Right. Well, Kennedy doesn't just broadly criticize Dr. Fauci.
Okay.
He picks out specific moments where he thinks decisions made really had a negative impact on public health.
So he's got receipts. He's not just general.
Yes, he's got examples, yeah.
Yeah.
A big one is the AIDS epidemic back in the 80s.
Okay.
And Fauci's support of the drug AZT.
Oh, AZT. Now, that's something that maybe some of our listeners
might not
aren't familiar with. Can you give us a quick, rundown?
Sure. AZT, or azithromycin, was the very first drug approved to treat HIV/AIDS.
Oh, wow. Yeah.
Back then, it was a huge breakthrough, but it quickly became clear that AZT came with some pretty intense side effects.
Like what?
Like severe anemia that would require blood transfusions.
Oh, wow.
And Kennedy claims that these side effects were kind of downplayed or not properly documented when they were doing the initial studies.
Okay, so Kennedy's saying Fauci was full steam ahead, even with these risks.
Yeah. That's his claim, yeah.
Wow.
He argues that Fauci was so focused on just getting a treatment out there.
Yeah, just get something, anything.
That he overlooked the side effects. And, that potentially caused a lot more suffering for patients.
Wow, that's a pretty heavy accusation.
Yeah.
If that's how he starts the book, I'm a little afraid to see what comes next.
Well, then he fast forwards to COVID-19
Yeah.
a few decades later and argues that we see some of the same patterns, but this time it's global.
So that's how he ties AIDS to COVID. Okay, I'm starting to see the thread here.
Yeah.
So what, specifically, what are some of those patterns?
Well, Kennedy contrasts the U.S. response, with all the lockdowns and the focus on vaccines.
Right.
With places that went all in on early treatment using existing medications. He points to countries like India, who use things like hydroxychloroquine and ivermectin.
Okay.
And they saw way lower death rates than we did here in the U.S.
So is he saying Fauci just ignored all these potential treatments?
Yeah.
And just, fixated on vaccines?
Pretty much, yeah.
That seems extreme.
It's a strong claim. He actually uses the word calamitous to describe Fauci's impact on public health. And that's before we even get to COVID.
Okay, so we've got Fauci pushing AZT during the AIDS crisis, then tunnel vision with COVID. But Kennedy doesn't stop there, right?
Aren't even close.
Yeah.
One of the biggest themes in the book is how alternative treatments for COVID were suppressed. Kennedy claims Fauci intentionally downplayed and even worked to discredit drugs like hydroxychloroquine.
Actively worked against them.
Yeah.
But wouldn't health officials want to research any potential treatment? Why suppress it?
That's the question Kennedy wants us to ask.
Okay.
He talks about doctors being blocked from prescribing hydroxychloroquine.
No, really?
And he claims there were efforts to design studies that would make the drug look bad.
So he's saying the research was biased.
That's what he's implying, yeah. He even brings up Lancetgate, which was a big scandal where a medical journal had to retract studies about hydroxychloroquine.
Wait, Lancetgate?
Ugh.
I feel like I should know what that is.
Yeah.
But I actually have no clue. Can you break that down?
Sure. Lancetgate refers to this controversy with the Lancet, a prestigious medical journal.
Okay.
They had to retract these studies that made hydroxychloroquine look really dangerous and ineffective because the data was fake.
Oh, wow. So it was made up.
Yeah.
So is Kennedy saying there were people trying to discredit the drug, even if it meant using, fake science?
That's exactly what he's saying. And then he takes it even further and says Big Pharma's behind it.
Big Pharma.
Yeah, he says they have way too much influence over places like the NIAID, and they manipulate research to make money.
To maximize their profits.
Exactly.
Okay, hold on. How does he connect those dots? How does Big Pharma play into all this?
Well, he describes this revolving door
Okay.
where people move back and forth between government and pharma jobs.
Hmm.
And this creates a system, he says, that's ripe for conflicts of interest.
Conflicts of interest. I mean, that's
Yeah.
a huge red flag in any field,
Right.
but especially with public health.
Especially with public health, yeah.
Mhm.
He even points out that NIAID officials are actually allowed to receive royalties
What?
from drugs they help develop.
Wait, so they could profit from the drugs they're promoting?
That's exactly what he's suggesting.
That's wild. Isn't that like the definition of a conflict of interest?
You think so?
So we've got Fauci potentially pushing some drugs, downplaying others, and now there's this whole financial thing hanging over it.
Right,
But Kennedy doesn't just talk about individual drugs, right?
right.
He talks about a biosecurity agenda. Can you explain what that is?
This is where things get really interesting and maybe a little unsettling.
Oh, good. I was hoping for a little bit of unsettling today.
Kennedy describes this network of people, including someone named Robert Cadleck, who view infectious disease as a national security threat.
A national security threat. So, like, terrorism.
Kind of, yeah. He argues that this mindset has been used to justify more government control
Okay.
and surveillance in the name of keeping us safe.
And this is where he ties in all those pandemic simulations, right?
Yes.
Like Dark Winter, Atlantic Storm, Event 201.
Exactly. He sees them as a way of training for a more authoritarian response to future pandemics.
Okay, I'm officially unsettled now.
Yeah.
But we've covered a lot. Can you kind of sum up, like, for our listener, what are the key takeaways from what we've talked about so far?
So far, we've seen Kennedy raise concerns about Fauci's actions,
Yeah.
potential conflicts of interest,
Yeah.
downplaying risks, focusing on certain solutions, like vaccines, while dismissing others.
Right.
It's important to note that these are just Kennedy's claims.
Yes, we're
Yeah,
taking sides.
Presenting them.
Exactly. We're just trying to present,
You would encourage you.
to think critically.
Yeah, exactly. So what are your initial thoughts so far? What's standing out to you? Well, I'm really curious to learn more about this biosecurity agenda and the role of intelligence agencies in all of this.
Yeah.
But before we get into that, I think we need to unpack this idea of suppressing these alternative treatments.
Totally agree. There's a lot more to dig into there, especially with hydroxychloroquine and Lancetgate.
Yeah.
We'll dive back into all of that in part 2.
Looking forward to it. Picking up where we left off, this whole idea of suppressing alternative treatments,
Yeah.
this is central to Kennedy's argument.
Hmm.
And this is where hydroxychloroquine gets really interesting because it wasn't just dismissed, it was demonized.
Yeah, it seemed like anyone who even mentioned it was automatically
Yeah.
like a conspiracy theorist or worse.
Exactly. And Kennedy says this wasn't just scientific disagreement, it was a deliberate attempt to silence anyone who challenged the narrative.
Hmm.
He compares it to what happened with the HIV/AIDS hypothesis back in the 80s.
Oh, right. He talks about how scientists who questioned the link between HIV and AIDS were ostracized and their careers were ruined. Is he saying the same thing happened to doctors who, supported hydroxychloroquine?
That's exactly what he's saying.
Wow.
He claims a vendetta system was put in place to discredit and silence anyone who questioned the accepted wisdom on COVID treatments.
Hmm.
He even compares Fauci's tactics to the Spanish Inquisition.
Oh,
which
really?
might seem a bit dramatic,
A little bit.
but it shows you how strongly he feels about this.
Okay, I get that he's passionate, but isn't there a danger in only focusing on dissenting voices?
Yeah.
I mean, couldn't that lead to promoting conspiracy theories?
That's a valid concern for sure.
Right.
But Kennedy's point is that we can't just accept the dominant narrative without questioning it.
Okay.
He says true scientific progress requires open debate and considering all the possibilities, even the ones that seem, unorthodox.
So how does he connect this suppression of dissent to Big Pharma?
He argues that pharmaceutical companies, they have a vested interest in promoting certain treatments, especially the really expensive one.
Right, the patented drugs.
Yeah.
Okay.
And that they use their influence to shape research and control the flow of information.
Okay, but, I mean, couldn't you argue that they're just trying to develop effective treatments and vaccines?
Sure, there's always multiple perspectives, but Kennedy points to specific examples,
Like what?
like the promotion of remdesivir for COVID treatment.
Okay, what's the issue with remdesivir?
Well, it's an expensive antiviral that was granted emergency use authorization by the FDA, despite limited evidence that it actually worked.
Huh.
Kennedy says Fauci and NIAID pushed for its approval, even though there were cheaper and potentially more effective treatments out there.
So he's saying, like, money may have been a factor in choosing one treatment over another.
That's what he's suggesting, yeah.
Okay, that's definitely interesting.
And it brings us to another big player in this story, Bill Gates.
Yes. Bill Gates. Billionaire, philanthropist, turned global health expert, guru, yeah. Where does he fit into all of this?
Kennedy paints him as a sort of puppet master, using his money and influence to, like, shape global health policies to his liking. He says Gates' control over groups like the WHO and JVI gives him too much power to decide which diseases get attention, which treatments are favored, and which vaccines get pushed.
Okay. That's a pretty serious accusation. What evidence does he have to back that up?
Well, he points to Gates's huge investments in the pharmaceutical industry and argues that he uses his philanthropy to benefit his own business ventures. For example, Kennedy criticizes Gates's push for mass vaccination in developing countries, suggesting it's really about creating new markets for the companies he's invested in.
Okay, that's an interesting take. I mean, it makes sense someone with that much money and power would have an agenda.
Yeah.
But isn't it possible that Gates is, like, genuinely trying to improve global health?
It's definitely possible, and there's no doubt he's made big contributions to global health.
Right.
But Kennedy's concerned about the lack of transparency in how these initiatives are actually carried out.
So you're saying we should be more critical of the motives behind these big philanthropic efforts?
Exactly. He wants us to ask, who benefits from these policies? Are they really helping people, or are they all about profit and control?
That's a good question. It applies to way more than just health.
Right.
But let's stick with vaccines for a second.
Sure.
Kennedy gets pretty specific about his concerns with certain vaccines, right?
Yes, he raises concerns about the DTP vaccine, the dengue fever vaccine, Dengvaxia, and the HPV vaccine, Gardasil.
Okay.
He talks about anecdotal cases and points to studies that suggest potential side effects and risks associated with these vaccines.
But vaccines are like a foundation of modern medicine.
Right.
They've saved countless lives. Is he really suggesting we abandon vaccines altogether?
Not necessarily. He's not anti-vaccine. Okay.
But he is pro-choice and pro-informed consent. He argues people should have the right to make their own decisions about vaccination based on accurate information.
So his issue isn't with vaccines themselves, but with how they're, like, promoted and mandated.
Right. He's concerned about the lack of transparency regarding the risks, and he thinks people should be able to weigh those risks against the benefits.
Okay.
He also thinks we need more research on the long-term effects of vaccines, especially for kids.
That's definitely a controversial viewpoint, and I think it's important for our listeners to do their research, talk to their doctor,
absolutely,
make informed decisions.
Yes.
But let's switch gears a bit and talk about something I found really disturbing. Kennedy's claims about a sterilization campaign in Africa through tetanus vaccines.
Ooh, yeah, this is a sensitive and debated topic.
Right.
Kennedy talks about these longstanding accusations against the WHO, saying they promoted tetanus vaccines that were laced with sterilizing agents.
Targeting African women.
Wow.
He presents anecdotal evidence and cites studies that suggest a link between the vaccine and infertility.
Okay, if that's true, that's awful.
Yeah.
But it also sounds like a conspiracy theory.
Right.
Is there any, like, credible evidence to support these claims?
It's important to note these accusations have been investigated and debunked by reputable health organizations.
Okay.
But Kennedy says these investigations were flawed and there's enough evidence to warrant more scrutiny.
So where does that leave us?
Yeah.
It sounds like there are strong opinions on both sides.
Yeah, it's a complex issue with conflicting information, and you got to approach it with a critical mind.
Well, one thing's for sure. Kennedy's book really makes you think and question everything you thought you knew about public health.
For sure.
But we haven't even gotten to his biosecurity agenda yet, and that's where he, like, really goes down the rabbit hole, right?
That's where he gets into the conspiracy theories.
Yeah.
He presents some interesting ideas about the role of intelligence agencies and the possibility of the government, like, overreaching in the name of public health.
Right.
And it's not just theories. He talks about real people and events.
Okay, I'm ready to go down that rabbit hole.
Let's do it.
All right, so we're back, and it's time to finally get into this biosecurity agenda thing.
Okay.
I got to say, this is the part that, like, really had me scratching my head. It
Yeah.
kind of felt like, like a sci-fi movie.
It gets pretty out there. Basically, Kennedy's saying that there are these groups,
Yeah.
including people in the government and intelligence agencies,
Okay.
who see diseases not just as health problems, but like national security threats. And this, he says, has led to this whole mindset where control and surveillance are more important than individual freedom.
Okay, that sounds scary, but how does he back that up?
Well, he points to those pandemic simulations we talked about.
Right.
Like Dark Winter and Event 201.
Yeah, those were pretty freaky.
Right. And he says that a lot of the people involved in those were from the intelligence community. And according to Kennedy, they kind of predicted a lot of what actually happened with the COVID response.
So wait, he's saying they weren't just trying to figure out what could go wrong?
Right.
But they were actually planning for a very specific response.
Yeah, one that involved a lot more government control.
That is definitely a little unsettling. So who are the big players in this biosecurity agenda?
Well, one of the main people he focuses on is this guy, Robert Kadlec.
Kadlec, yeah. Okay, remind me again, why does that name sound familiar?
Well, Kennedy ties him to companies like Emergent Biosolutions,
Okay.
which made a ton of money from government contracts for things like, anthrax vaccines and then later COVID vaccines.
So is Kennedy saying that this biosecurity agenda isn't really about public health at all?
Well, he's suggesting it might be more about making certain people and companies a lot of money while also giving the government more power.
Wow, this is kind of reminding me of what we talked about before with those potential conflicts of interest with NIAID and Dr. Fauci. It's like the same themes were popping up again and again.
Exactly. And it's not just government agencies. Kennedy brings big tech into the mix, too.
Oh, boy. Here we go.
He talks about how social media sites like Facebook and Twitter were actively suppressing information that went against the official narrative about COVID. He even says that intelligence agencies were involved in flagging and removing certain content.
So wait, is he saying they were controlling what information we were allowed to see?
Yeah, that's his claim.
That sounds pretty conspiratorial.
It's definitely controversial. And, the social media companies say they were just trying to fight misinformation.
Right.
Protect public health.
Okay.
But Kennedy argues that this kind of censorship is dangerous.
Yeah, I mean, if we can't even talk about different viewpoints,
right,
how can we make informed decisions about our own health?
That's his point. He thinks that suppressing dissent creates this environment where only certain opinions are allowed, and that hurts scientific progress and also public trust.
So what's the big takeaway here for our listeners?
Well, Kennedy's book is kind of a call to action.
Okay.
He wants us to be skeptical, question authority, and do our own research.
Don't just take their word for it.
Exactly. He's saying we need to think critically about the information we're given.
Right.
Look for different perspectives.
Okay.
And be willing to challenge what everyone else thinks.
And I think that's a good place to wrap things up for today.
Yeah, I think so too.
This deep dive was intense, but it's definitely made us think about some really important things.
Yeah, some big, big issues. What stood out to you the most?
Honestly, for me, it was that constant theme of power and influence. Like whether it's big pharma, the government, or big tech, Kennedy's book just raises a lot of questions about who's really controlling the narrative when it comes to public health.
Yeah, and it makes you wonder, whose interests are they really serving?
Right, exactly.
Yeah.
And how can we be sure that those policies are really putting people first?
Yeah, that's a question we all need to think about. And remember, this deep dive was just a starting point.
Right.
We want you to keep exploring these ideas, do your own research, and form your own conclusions.
Because the deep dive doesn't end here. This is just the beginning of your exploration.